Welcome everyone to HELD, Congregations Showing Up for Each Other's Mental Health. My name is Laura Gregorio. I'm the president of a company called Humanist Care. I'm also a NAMI board member. We will be starting in just a minute. And as everyone is getting settled, we are going to go over a few logistics for this session. Today's event is being recorded. We will be sending and posting the recordings on our NAMI California website, YouTube. All attendees are in listen-only mode. We invite you to use the chat box during the event for interaction and comments. If you would like, please hold your questions for our Q&A session, and we will answer all questions at the end of the presentation. We invite you to take the evaluation survey that will be sent to you at the end of the conference. Your feedback will be greatly helpful for our next conference. As we share this virtual space together, let's create a safe space with our community agreements. Let's be curious, open, and respectful. We learn from each other. We all have our knowledge and perspectives of the content. Share the space. For time we may speak, we ensure that we remind ourselves of the time allowed so that everyone has an equal opportunity to share. We speak from our own experience. We use I statements. We accept and be sensitive to diversity. Learning leaves, but names stay. We maintain our confidentiality. We take care of ourselves. Please allow yourself time to step away to practice self-care throughout or after the session. Reserve the right to change your mind. You are welcome to stay or leave as you choose. In the event of any disruptions or emotionally charged events, we will immediately close the session and redirect you to a different session, and will send or post a recorded version of this session. I would now like to introduce our speaker. Reverend Barbara F. Meyers is a Unitarian Universalist community minister with a mental health ministry based in Fremont, California. She is an assistant director of the Life Reaching Across to Life Peer Support Center, the author of a mental health curriculum for congregations, and the book HELD, Showing Up for Each Other's Mental Health, published by Skinner House Books in July of 2020. She is the president of the UU Mental Health Network and served on the UUA's Accessibility Committee beginning in 2005, and was active in the creation of EqUUal Access, as well as on the UUMA's Task Force on Disability in 2017-2018. Reverend Meyers was especially involved in the creation of the AIM program to make congregations accessible and inclusive of disability. Today, Reverend Meyers will discuss stories from her mental health ministry, both how-to stories and how-not-to stories, giving guidance for congregants in the pews who want to help make a difference. And with that, I will hand it over to Reverend Meyers.
Thank you, Laura. It's good to be here. Let's see, I'm going to put up my presentation here. If you can see that. Okay, I'm going to be talking about some of the ideas, the stories that I come across in my mental health ministry. And I've recorded many of them in this book that you can see here on the screen. The title is HELD, Showing Up for Each Other's Mental Health. And I'm really happy to be sharing it with you here at this conference, this NAMI conference. I'll start with a story. There was a woman who told me, she was a Unitarian Universalist woman, and she told me a story that she and her husband had a daughter that was seriously mentally ill and was in the psychiatric ward because she was having a serious episode. And they were coming home from work every day, grabbing something to eat and going off in the evening to visit their daughter in the hospital. And one evening they got a phone call from the church, and someone in the church said, we're so-and-so in the congregation has a family member who's in the hospital, and we're all trying to put together casseroles. Do you think you could make a casserole and take it to them for dinner tonight. And they wanted to help. So she and her husband put together a meal and they brought it over to this other family's home. And then they rushed off to visit their daughter in the psychiatric ward. And she told me that on the way home, she thought, wait a minute, we have somebody that's in the hospital. Nobody's making us casseroles and bringing them over to our house. Is there a double standard here or something? And I'm going to tell you, yes, there is a double standard. Many times people that have family members that are in the psychiatric ward don't have folks from the congregation or from some other friendship place coming over and bringing meals to their home. It's kept quiet. And some of this could be because they didn't make an announcement of the fact that they had their daughter in the psychiatric ward. It's probably the same thing is true of rehab for substance abuse problems, that isn't, people don't rush to help. So if there's one message that I want you to take away from this is the no casserole disease situation needs to stop. We need to be telling our congregation members that we have a family member in the hospital. And when we hear that someone has a family member in the hospital, we ask, would you like us to bring you a meal? I know this must be really hard for you. And so I wanted I guess it's also a little more than that. I mean, providing pastoral care. So if the minister goes to visit somebody that's in the hospital, when they're in the hospital, you go visit somebody when they're in psychiatric ward if they're willing to have visitors too. I'm remembering the time from when I was hospitalized in a psychiatric ward, and there was a woman, another patient there with me, and she was completely shut down, just completely flat effect. She wouldn't respond to anything, or just a flat face, sort of a dead expression. And there was one evening when her minister came to visit her, and her face lit up. I'll never forget that. Just face just lit up, because somehow the association that she had with somebody that was a religious leader coming to visit her was something that gave her great pleasure and hope when nothing else seemed to do so. So some of you may already know some of this, but I talk a little bit about prevalence. So 1 in 5 American adults each year are diagnosed with a mental health problem. Nearly half of these, 40-some% of these, coexist with addiction. Many of people are sort of trying to self-medicate themselves with addiction. That's one of the things that happens. And it's been worse since the pandemic. I've heard numbers like 1 in 4 now. So any Sunday morning, the pews or the Zoom screens, however you meet in a congregational setting, are filled with people that are living with mental health problems and their loved ones. And many of them are sitting there suffering silently and hoping that this time in the congregation and this Sunday morning message is going to give them hope. So what does mental health recovery mean? SAMHSA, Substance Abuse and Mental Health Services Agency of the US government, has a working definition of recovery: a process of change in which people improve their mental health and wellness. They live a self-directed life and they strive to live to their full potential. It doesn't necessarily mean the absence of symptoms or the absence of the need for medications. So for example, I myself sometimes have symptoms and sometimes I need medications, and yet I consider myself to be in recovery. I'll tell you a little bit about my own story. That's a picture of me when in 1978, with my 10-day-old daughter, Carol. And shortly after that, after that picture was taken, I had a very severe postpartum depression in which I was suicidal. I just didn't want to live anymore. And I was hospitalized for my own safety. And it was a deeply disturbing experience to me. I didn't want to think like I was anything like those kind of people, the way I was thinking at that point. And I felt like I was a damaged human being. And even though I was one of the lucky ones who was able to, the first medication they tried worked for me, and I was able to get back to my regular normal life with, being a wife and a mother. And I had a career at the time as a software engineer working for IBM, which I loved. And I was able to get back and doing that, but I was deeply unhappy with the fact that I had had this damaging experience in my life and that I was somehow less of a human being because of it. When my daughter was 8 years old, so this is how long all this all went on, I thought, I don't want to live my life like this anymore. I went back to my psychiatrist, the same guy that had taken care of me in the hospital. And I told him that I really wanted to explore what was going on because I was so deeply unhappy and I was willing to make any kind of changes in my life in order to get out of that way of thinking. And so I started seeing him fairly regularly. And one of the things that he asked me, and I didn't realize at the time how unusual it was for a psychiatrist to ask me, this was in the mid 1980s, what do you do for yourself spiritually? And I said, nothing, because at the time I wasn't doing anything for myself spiritually. I had grown up as a interdenominational Protestant and had gone to youth group and Sunday school and so forth. But after college, I had left that and gone a different way. And he said, well, would you like to learn how to meditate? And when he asked me that question, I thought, what? You've got to be kidding me. Sitting around and doing nothing? How is that going to help anything? Because I was one of those people that was doing, and more doing. And I thought that's how you lived your life and how you made your life better, is to do more things. But I had promised myself that I was going to try anything that he asked because I was so deeply unhappy. And so he taught me how to meditate and he gave me a little book and I went home and read it. And I would sit sometimes for 5 minutes a day or 10 minutes or 15 minutes maybe quietly. And it was literally the only time that I had in my life that was quiet, because the rest of the time I was rushing around doing various things for my job and my family. And when I went back to see him, I told him, I don't know where it came from, but I'm happy. And I'll never forget what he said. He pointed at me and he said, it came from you. And it was one of those moments where, your head just completely, what? He's right. Oh my gosh, my whole way of looking at things changed pretty abruptly at that point. That there is something precious and unique within me. In fact, each person has something precious and unique within them. And this is where happiness comes from. It isn't something that you get because of what you do or what somebody gives you or how many people love you. It's something that's within, and that's where it came from. And it really struck me as something very important. And after that, I told him, I don't think I need to come and see you anymore. I don't think I need to take medications anymore. I'm just going to quit taking my medications. And within 3 weeks, I was, and this is something that is not very wise to do, which I now know, to stop taking psychiatric medications cold turkey like that. I was back in the hospital, and this time I was psychotic, and I was admitted involuntarily to the hospital. And my psychosis was that I thought that I was dead, and the psychiatric ward was full of all God's children that were just waiting to be reborn like I was. I know this sounds really strange that somebody that's walking around and going to groups and stuff thinks that they're dead, but in fact, that's what I thought. And after I got back on my medications, my view of reality became a little bit more like what other people's view of reality was. But I was a changed person when I recovered. And in fact, I view my, after I, sort of came back into another way of looking at things, I would think, what was that? Why did that come to me, that I was dead? And I now understand it after having studied and read, that there's such a thing as a psychological death of ego, where I wasn't physically dead, of course, but my old way of looking at the world was dead. My old way of viewing myself was dead. And it was a completely, I consider it to be, rebirth isn't too strong of a word to put to that. And, I was, ended up eventually, after a number of years, left my job at IBM, and I realized that something spiritual had gone on, and I joined a congregation. I joined a Unitarian Universalist congregation because I thought the word universalist sounded like my new way of looking at the world, because those patients, I wasn't afraid of them. They weren't those kind of people. That were me. They were all God's children. And that was a whole completely different way of looking at world. And eventually I ended up leaving my job and going to seminary and becoming a minister, wanting to focus on mental health issues. So that's sort of where I come from on this. So some of the things that I have found particularly important to get across to people, many of you may already know this, but just want to point it out that there are many elements that make a person heal and recover. And it isn't just taking these pills and everything's going to be okay. There are lots of things that are important in a life. There's the spiritual aspect, just like I was introduced to that. There's the intellectual aspect. What am I learning? What new things, what new concepts am I introducing myself to? There's a physical aspect, keeping yourself physically healthy, getting exercise, eating good food, not smoking, not drinking very much alcohol, physically making yourself healthy. There's environmental aspect in terms of where do you live? Is it a friendly place to live? Do you get to go outside in the sunshine and experience nature? There's a financial aspect. Do you have the finances that are available to allow you to live the kind of life that you want to live? There's the occupational aspect. Are you doing something with your life that you think is important in the world? I know now with my career in ministry, I think I'm doing something important in the world, more important than what I was doing before, even though I loved that job before. There's a social aspect. What kinds of relationships do you have with other people? I mean, human beings are relational people. That's important. And then there's the emotional aspect. What kind of ups and downs do you go to, and have you learned how to regulate them when you go through it? So all of these things are important in order to heal. And the message that I give to churches is that people in the congregation can help with many of these kinds of things. that aren't covered by professional mental health services. They can be friends. They can have, encourage somebody in their intellectual learning new things. They can encourage people to take care of themselves physically. Whoops, I just skipped that. And you don't have to be a professional mental health person to be able to help folks through these kinds of things. And the people in that congregation that I joined were very good at helping me in all these ways, even though I didn't tell anyone but the minister that I had just gotten out of a psychiatric ward with a psychotic episode. So a mental health crisis is a spiritual problem as well as a psychiatric problem. A person may experience doubts about their own selfhood, what is truth, what is meaningful, what does love mean, what agency, what am I able to do with my life? And in fact, it may undermine their faith in the divine and their belief in justice. So it can be difficult. And spiritual awakenings have been, this is well recorded truth. Spiritual awakenings have been common in the founders of almost all major religions and their followers. And I just have a list here from Judaism, Christianity, Latter-day Saints, Islam, Quakers, Hindus, Buddhism, Ralph Waldo Emerson, Unitarian, all of these people had spiritual awakenings, and some of what they learned from that and the value that they got from that was what made them effective spiritual leaders. And it is also a fact that spiritual practice is helpful to many people that have mental health problems. In fact, there have been studies that have done that show that spiritual practice is the #1 coping skill that people with mental health problems and their family members use. They meditate, they pray, they listen to music. Sometimes people go for spiritual direction. They might engage in some kind of practice like Tai Chi, Qigong, or yoga. They might chant. This is just a partial list of all the possible kinds of spiritual practice that people do. But a lot of times when you ask folks, that are undergoing serious mental health crisis, what do you do that helps? And they'll say, I pray. And so it's the #1 thing they go to, even though, and this is true, even though with the invention of psychoanalysis by Sigmund Freud, he believed that religion was an illusion. So from the beginning of helping practice of helping people with mental health problems, religion was denied and even as taught as being a symptom. If somebody says that they have had a spiritual experience, that's a symptom. That is changing, I believe, in the last 10 to 15 years, but it is not unusual for that to happen. And I realized when I learned all of this, how incredibly fortunate I was that my psychiatrist back in the 1980s, who had an active spiritual life himself, asked me that question. So I'll tell you a story about hope. Hope has been shown, many of you maybe have already heard that hope sometimes is called the first step in recovery. And it doesn't mean that the person knows exactly what's going to happen, but knows that it might be possible for something to happen. And that's the first time that they might get recovery or start to recover. So I'll tell you a story. This is from the first time that I was hospitalized, when I was in the psychiatric ward, suicidal, and just wanted to die. The doctor said he could help me, and I thought, he just tells that to everyone. And my family said that they really wanted me to get better and come back, and my thought was they'd be better off without me. And then I think the second or third day that I was there, there was a woman who came and sat down next to me. And she said she'd been in the hospital for 3 weeks. And she had been very ill when she came in, and she was now ready to go home. And she felt so much better. And she told me that since she got better, she knew I could get better too. And when she told me that, I thought, maybe there's hope for me. That was really the start of my recovery. Where did it come from? It was from another patient. I wouldn't believe the doctor. I didn't believe my family, but when it was a peer, a patient telling me that, then I could start to believe it. And this is one of the reasons why I am so focused on working in peer support, because I know that that is sometimes the only way that folks are going to believe that it's possible, and that it's possible for them to recover too, and believe that. And sometimes we have to hold hope for somebody if they don't see it, and we can tell them that I am holding hope for you, and just the fact that they know somebody is holding hope for them might be a lift for them. Okay, presence. It's sort of presence is being with someone, actively listening to them without judgment. Don't say that anything's right or wrong. You validate the feelings that you see, because the feelings are real, even though they might be very disturbing. And you don't give them advice. Don't tell them what to do. You're just there as a loving, caring presence. Presence is a sacred gift. I'll tell you a story from when I was first a part of in my ministry. I was an intern, actually, before I became a minister. And I was in this fairly large church, and we were running around, bustling around on a Sunday morning, getting ready for the worship service, and lots of, activity going on. And there was a woman who I had met, who I knew was living with severe anxiety. And she came up to me and she said, Barbara, please help me. I'm so anxious. I don't know what to do. Please do something to help me. And I thought, gosh, what can I do? And so I suggested that she and I go and sit in another room. There was a library there that no one was in. And she and I went in the library and sat down, and I closed the door. And I sat there holding her hand. And I was thinking, what can I do? What can I possibly tell her to do? I can't think of anything I'm going to be a failure as a minister if I can't think of anything to tell people to do. And no words are being spoken. I was just there with her. And after a couple of minutes, she turned to me and she said, I feel so much better just being here with you. What a lesson for me. It wasn't anything that I was going to say or anything that I was going to tell her to do, or any neat program that I wanted her to enter or anything like that. It was my physical, caring presence, my sitting there holding her hand. That was what helped her at that moment. And I had never forget that lesson. And I've thanked her for that, after the fact, that I really learned something important from her. And I have learned the same lesson a number of other times, in my ministry, of help being with someone or being there with someone, and then them telling me what incredible help that was them, even though I wasn't doing very much of anything other than just being present with them and just realizing how important. And I think this is something that anybody can do. Your presence with somebody that's suffering is sacred, and being there with them, not trying to tell them what to do, not trying to give them advice, trying to understand what their feelings are going through. That's what is the gift of presence. And also empathy. Now, what is empathy? It's the ability to see the world as another person sees it. It doesn't mean that you have to agree with them, just trying to see it the way they see it. And a lot of times, you know, the fact that somebody is trying to see the way they feel, even though they realize that the other person isn't completely on the same wavelength, is really trying to help them, that is really very important as well. And then in a congregation, creating a place that's safe so that there isn't the silence and the secrecy and the shame about mental illness. If there are negative comments that are being made about mental illness, that needs to stop. It's not good to have folks, you know, and there's a story that's in my book. It's a little bit longer than this, but there's a woman who, story about a woman who was in, she was trying out a new congregation, and she was in coffee hour after the service. And there were people that were talking about, I don't pay attention to that person, he's a nutcase, making comments like that. And there's a whole list of this kind of comment that she heard in a congregation. And did that make her feel like it was safe for her to come and tell about what's going on in her family? No, it made it like, I need to keep this a secret here because these people aren't going to understand. This kind of thing has to stop. And a message needs to be given to folks that it is not okay to make comments like that in the congregation. Okay, one of the things that I do when I am asked to give a sermon in congregations, and I've done this many times now, it's like I go to the congregation, they ask me to come and talk about mental health because they think that's something that their congregation needs to know about. And I tell a little bit of my own story, not because my own story is so wonderful, but because I know that when somebody stands up and says, this is my story, and it's something that normally wouldn't have been said in public there, that it makes it safe for another person to admit that, oh, okay, you know, this is a place where we can tell stories like this here. And then at the end of the sermon, I ask people if they would rise in body or spirit if they or a loved one of theirs is living with a mental health difficulty. And every time I've done this, and many times, somewhere between 80 and 100% of the people will stand up. And no one can believe the fact that there's so many people standing up. They look around and they say, oh my gosh, I had no idea. And then in the coffee hour afterwards, there's these stories that start, you know, well, my sister had bipolar, or my grandfather had a problem, or I've had a problem, or whatever. And it's okay to talk about it because they realize that practically everybody that's there is affected in some way. And that's the most effective stigma buster. If you're looking for stigma busters, having a public witness like that is the most effective one that I found. And, you know, since COVID, and I've done a number of sermons online, you know, I've sort of used the chat for that. You know, I say, write yes in the chat if this applies to you, and write no if it doesn't. And then there's this string of yes, 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 no, yes, 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 that come across. So if any of you are thinking about, you know, church services about mental health difficulties, that doing something like this at the end, I think is really important, and it's very effective. Suicide can be very disturbing and troubling for the family, the friends, and the fellow congregants. This is a picture of Kevin Hines, which some of you may know, who survived a suicide attempt off of the Golden Gate Bridge and now devotes his life to trying to advocate for suicide prevention. If somebody is having serious suicidal problems, professional mental health care is necessary. The important congregational role that people can make is authenticity, which means basically finding something that you like about that person, and when you're talking to them, focusing and concentrate on whatever it is that you like about them, because even they'll somehow subconsciously pick up the fact that they are loved and appreciated and liked, even though they don't like themselves. And of course, offering them hope and empathy and compassion is also important. And the same thing is true if there's been a suicide in a congregation, offering a safe place for the family to be. And if some of you have been active in FaithNet NAMI, you might have seen a list of things that were created a number of years ago about how to go about starting a mental health ministry in your congregation. You start out getting the support of the minister and the lay leadership in the congregation, so you're just not off in a corner doing your own thing. You create adequate guidelines for appropriate behavior in a congregation, a behavioral covenant, a disruptive behavioral policy can be very important. You have a worship service that focuses on mental health. You have education that you can give to the congregation. The book that I wrote actually is written with a study guide in it, so that it can be used for people to learn about congregational, what kind of support congregations can give. You give support for religious education. RE is religious education support for children if they're having difficulty, which basically sometimes means having somebody be there with their children during RE so that they can help the child if there's a problem. You have provide support groups, either if it's not within your church, but find local support groups that you can refer people to, making referrals to programs or therapists or whatever that other people in the congregation have found useful. There's a companioning program that was developed and by a United Church of Christ minister, and it is now on the Pathways to Promise website that people can be companions in the congregations that are having mental health difficulties. And then it's providing pastoral care and spiritual support to people as well. So there's a whole long list of things to do. The kinds of things that help an individual. There's a longer list of this in the book, but basically getting professional work, learning how to manage your stress, being aware of your emotions, enriching your life in some way, and engaging with your spirituality. And justice issue, most of us know that insurance and money issues can be really make it difficult to get adequate mental health care. If they're inadequate, people don't take it, and there's not the wide availability, and so it's hard to find a practitioner accepting new patients. I know a lot of people have told me that. And then sometimes alternative therapies are too costly. Let's see, what am I doing here? Cultural and linguistic and geographic issues, Black and Indigenous and people of color or BIPOC, LGBTQ, teens, people that don't have English language have sometimes problems. Involvement in the criminal justice system, this is really a big thing. In my county here in California, 40% of the people in our jail are on psychiatric medications, and tragically, and I've known several people personally where they've called family members have called the police to get help for someone that has a mental health crisis, and the police end up killing the person. And this is tragic for everyone concerned. So really, really difficult problems there. And I think some of them are starting to be addressed, but it is sadly true, I believe, that often the most troubled people get the worst care for a lot of these reasons. There are some low-cost options. Many fine peer and self-help groups are free. The place I work for, Alameda County Network of Mental Health Clients, is free to anyone because we're supported by our county. And some local governments have social services that are free on a sliding scale. It may be possible to get online support. I know NAMI has a number of online groups that they run in the evenings that are free to people. And then some of those things that I said, what helps an individual, don't have a cost associated with them. And that is my book. And if you're interested in getting a copy, and my contact information there, bfkmeyers@gmail.com. So that's the end, I think. So that's that's a different contact number, but I have a number of different emails, so that's one. So I'm going to stop my share right now. And
thank you so much. That was fantastic, Reverend Meyers. Thank you so much for such in-depth, fantastic information, really actionable items that people can be putting into place in their local communities. We are going to open the floor up for some questions. So please use the chat box to type in your questions. I also want to remind everyone to honor the community agreements we went over at the beginning of the session. If we do not get to your question, we can collect them and answer them in a follow-up email. I do have a couple of questions that came in throughout the session, so I can go through some of those right now. Michael says, I am hoping that you will list some groups we can follow if we would like to pursue advocating for mental and emotional awareness within the faith community. I think you did do that towards the end. I think he put that in at the beginning. So
yeah, the NAMI has something they call Faith Net, and under their website that has a lot of information for faith communities. There's also the Pathways to Promise website is an interdenominational website, interdenominational. They have many different religious organizations belong to that, and it's basically support for religious support for congregations of various different religions that are having mental health. They want to learn how to be supportive to people with mental health problems, and they have lots of resources on there, especially the companioning program. I really recommend that, people looking into that to see what is it that I can do to be a good companion to folks. It was Reverend Craig Redenbaum was the one that developed that, and Pathways to Promise has that. They're also, Pathways is also the home of something that's called Mental Health Ministries, which was a organization started by a Methodist minister, Reverend Susan Gregg Schroeder. She has something she puts out. I think she's retired now, but somebody's taken that over in Pathways, and they put out every quarter. They have a spotlight of various different things and resources for individuals and congregations that are trying to be supportive to people with mental health problems. So I hope that's a start anyway.
That's fantastic. You're just a great wealth of knowledge. Fantastic resources. Thank you. My dog is barking, so I apologize. And then it looks like just some comments. Cecilia says the Catholic Archdiocese of San Francisco and San Jose is working with parishes in formatting emotional and mental wellness ministries. St. Raymond Church in Menlo Park is launching the ministry on November 7th.
This is good to know.
Yeah, a couple of other comments from Ron. Thank you for sharing from a female leader perspective. It's also nice to see diversity from all, especially in times of political crisis. I follow 3 faith-based communities due to my advocacy work throughout California. And then he goes on to say, plus good to see more connections of faith and mental health, healthy sharing, conversations for understanding, seeing the common values regardless of institution or cultural community. Awesome. Let's see, Roxanne says, do you feel supported by mental health professionals? What sort of therapies do you as a clergy person believe are effective?
Oh boy, well, that's really depends on the person, because some people, so I happen to have a good experience with professional mental health care, and with taking medications and going to see my psychiatrist. I have also heard stories from many people that have not had good experiences with professional mental health care. And most of them have found help within peer organizations that can help people to understand, learn from people that have been there, and so it really depends on the person. And it's one of the things that I'm the board president of what we call the Unitarian Universalist Mental Health Network. And one of the things that we have said as a board of the Mental Health Network is that we want to honor each person's unique path to wellness. And people take different paths to wellness, and they can, some people like me can be helped by professional mental health care. Other people have, like I said, found good support in peer or in some of the, the less medicalized ways of recovering. And it really depends on the person. What is effective now, and trying to find out what is effective for a particular person is what I think is going to be what works for them, So there isn't any one answer to that. I guess what I'm trying to say. There's lots of people need help in different ways, and to try to be supportive to whatever it is that is helpful to somebody.
A continuation of that question, which I think you pretty much just addressed, but if anything you want to add on to it, and the next part of the question is, do you feel much mental illness is in a large part a spiritual problem?
Well, I certainly think that some of it is a spiritual problem. I think in my case, it was, I think, because spiritual, being more attuned to my spiritual life and taking care of that was really one of the things that brought me a completely different way of looking at the world. And then my unhappiness and my way of looking at myself as somebody that's a failure as a human being was completely stopped after I was able to be involved spiritually. So there is a component of that, and with different people it's going to be different, of course, but the answer to that is yes, it can be.
Awesome. Thank you. It looks like we don't have any other questions. Any other final questions from the group? Last call. If we didn't get to your question and something pops up, you can, of course, email. We've got a couple minutes left, but if no more questions are coming in, we can just say thank you so much, Reverend Meyers, and thank you everybody for joining us today. Fantastic discussion, fantastic information. For any questions on the content shared today, you can, of course, contact Reverend Meyers. Her information was up there. Any questions or concerns about today's event, please feel free to email NAMI at nami.california@namica.org.